the House Insurance Committee. Welcome. We have two bills to hear today, but first of all, let me recognize our Sergeant at Arms, Jonas Cherry. There he is. Michael Galloway, Warren Hawkins, and Stafford Young. Thank you, gentlemen, for all you do. And we have some pages with us today. Do we? Did they leave? Oh, there they are, back there. You guys could sit up here if you wanted to. You're allowed, but okay. Warren Chin, who you can come up as I call your name. How about that? Warren Chin, who is sponsored by Representative Liu. Maya Thomas, sponsored by Representative Wansey. And Hilmi Toback, sponsored by Representative Price. Glad to have you young folks here learning about your state government. Okay, we'll jump right in, and we'll hear House Bill 297 by Representative Belk. You're recognized. Oh, there is a PCS on the bill. Do we have a motion to?
So moved.
To
have the PCS before us.
All right. So Representative Setzer moves
To have the PCS.
to have a PCS before us.
All in favor.
All in favor say aye.
Aye.
All opposed no. Motion carries.
Thank you, Mr. Chair. Committee members, first I'd like to thank Representatives White and Carney, as well as Representative Lambeth for sponsoring this bill with me. The Breast Cancer Prevention Imaging Parity Bill is specifically aimed at helping three specific groups afford medically necessary tests. Patients who have survived breast cancer, patients who are in increased genetic risk of breast cancer, and patients who have discovered a breast abnormality with standard screening. The issue is that routinely used low mammography testing is deemed insufficient to detect breast cancer in these patients. However, more precise tests like ultrasound and breast MRIs have copays that vary widely across our state depending on your health plan. In our state, copays vary from $250 to over $1,200, and I recently was told that there have been incidents where they are actually $5,000. So depending on what your health plan is and where your location. Some patients are choosing to forego or delay the test, which means some of them have undetected cancer, which will be more costly and dangerous to treat when it's finally discovered. H297 will make it so that the same cost-sharing rules that insurance companies apply to the mammograms will apply to these more precise and medically necessary tests for those specific patients. Now, you may recognize 297 since this is the fourth biennium it has been introduced. It has passed the House with only one single nay vote in 6 years, only to be held up, and I'm sure you can guess this, in the Senate. So the changes we have made are in service of overcoming that hurdle this time around. So thank you, Mr. Chair, and thank you. I will stand for any questions.
Representative Setzer, you recognize?
Thank you, Mr. Chair. At the appropriate time, I'd like to make a motion.
All right. Are there any other questions from the committee? Representative Lambeth?
I just want to make an observation. I know there is some concern by the state health plan that this will add cost. I think one of the problems we have in our system of healthcare today is we don't do enough preventive care. And until we recognize that we need to pay for preventive care, that eventually will result in significant savings from early diagnosis. And I think that's what this bill does. Yes, it's going to cost some money, but it's also going to detect things earlier, and that should be, it's hard to know what that return might be, but that will result in significant savings down the road that I hope that some way and some point we can get to in this country of measuring preventive care and how do we know that that was valuable in terms of value-added services in healthcare. So I'm fortunate to be one of the sponsors on this bill, and I do support it.
All right. Any other comments or questions from the committee? I think we do have one person from the public who has signed up to speak. And if you want to come up, we'll give you a whopping 60 seconds, Mr. Daniel. How about that? Go ahead. Yes, sir.
I'm Peter Daniel, the Executive Director of the North Carolina Association of Health Plans, and we appreciate this opportunity for 60 seconds. We're eager to collaborate with the sponsors to address unintended consequences in the bill as written. Currently, supplemental breast imaging, like MRIs and ultrasounds, is covered when medically necessary. While this might sound nice at first, this shifts costs to premiums, increasing them by millions of dollars statewide. We agree that costs should not be a barrier to necessary care, but simply changing how the procedure is paid for does not address affordability. Instead, we should look at why these tests cost as much as they do. This also conflicts with the expert medical guidance from the United States Preventative Services Task Force, the American Cancer Society, and the National Comprehensive Cancer Network. We would love to work with the bill sponsors to improve the language and welcome that opportunity. And thank you very much.
All right. Thank you, Mr. Daniel. Sure.
And thank you so much for those comments. The bill that you see now is different from the bill that we have presented in the past because of what the gentleman said. We have talked to health plan representatives. We've changed that. We've gone and we follow their guidelines. What he is talking about is something that I don't want to get into because it starts to get into the weeds. But everything that we have done here and everything that we are covering is medically sound care that is necessary today. So we have heard and have worked with. We've also worked with some of the Dr. Campbell across the aisle and talked about changing some of the language and what expert committee is going to talk about the cervical cancer screening, because that is part of this. So what this is a recodification of saying that we recognize that we need to stop breast cancer. It is the second highest cancer killing in women, and we need to detect it early because of metastasize. When we start talking about having to deal with the cost that is incumbent on us when we catch it later and it might have metastasized, we are saying that or it very well might kill women. And that was the intent that this bill originally that this is taken from, because we had that mandate to say, and that's why we have the low dosage mammograms every year. And this is just saying, okay, there are some women that this is not going to get. And so this is in keeping with that bill that says we've got to do this. And it means lives and it means costs. So we are happy to continue to work, and we will until this gets done.
Thank you, Representative Bell. Representative Setzer, you're recognized for a motion.
For a comment and a motion.
Okay.
I'd like to thank the bill sponsor for bringing this bill forward. My mother is a 28-year breast cancer survivor, and I can tell you that diagnosis changes family dynamics quickly. Thank you for bringing it forward. And Mr. Chair, members of the committee, I'd like to move for a favorable report to the PCS for House Bill 297, unfavorable to the original bill, with permission for the staff to make technical corrections as is necessary, and re-refer to the Committee on Rules.
All right, you've heard the motion. Those in favor, let it be known by saying aye. Those opposed, like sign. Motion carries. At this time, thank you, Representative Bell. At this time, I'd like to turn the meeting over to my co-chair, Representative Balcom. Since I've got a bill to present. Thank you.
All right, thank you, Mr. Chair. So before us, committee, we have House Bill 357. Representative Humphrey has an amendment to be heard, so we're going to hear the amendment first. Representative Humphrey.
Thank you, Madam Chair. Let's see. First of all, let me thank my co-sponsors, Representative Setzer, ARP, and Allman. Thank you, guys, because this bill is it's a comprehensive bill, and I learned a lot. The amendment before you will basically change the membership committee, which will give appointment powers to the Commissioner of Insurance, 3 members appointed by the President Pro Tem of the Senate, and 3 members appointed by the Speaker of the House.
Have any questions? Representative Setzer.
Madam Chair, I move for adoption of the amendment.
The motion before us is adopt amendment. All in favor, say aye. All opposed? Amendment passes. On to the bill. Representative Humphrey?
Thank you, Madam Chair. So for those of you who don't know, a continuing care retirement community is a type of senior living center arrangement that offers a range of housing, health care, and support services to residents as their needs change over time. In other words, the way it was explained to me is that someone who maybe is just ready to move on with their life and not have a lot of headaches in owning a home may sell their house, and they will take the funds from the sale of the house and move into a nice community. These communities can provide all kinds of services based on your need, and as your needs change, they can be independent living, assisted living, nursing care or skilled nursing, and memory care. So if I sell my house and move in, as my health changes, I pay to receive these services. And what this bill will basically do, it will strengthen the current legislation to make sure these communities are financially solid and solvent. There have been cases across the country where these type of arrangements have been set up, and maybe the company, maybe they went bankrupt or had to close. I mean, fortunately, in North Carolina, I think we've been lucky, but this will reinforce the financial requirements of these continuing care retirement communities, and have staff and I have members from Department of Insurance that can answer the real technical questions.
Representative Pierce, do you have a
Yes,
you have a
for the bill
question?
sponsor, yes. Representative, well, who audits who would know about their books? I mean, is there an auditing process that would audit those different communities? Since you made that statement about they go bankrupt and all those, what happens in that process, if you don't mind?
Madam Chair?
Yes, absolutely.
Okay. The North Carolina Department of Insurance has their own division within the department, and they scrutinize and they look at the books, but this will require just put it in the law that these companies will have to have a certain amount of money. There's a whole lot of factors that go into it, but the DOI is in charge of that today.
Representative Lambeth?
First of all, I'd like to commend the bill drafters for a 56-page bill. This was interesting reading at night, and it immediately put me to sleep, so it took a few nights to read this bill. But it is very comprehensive. I do think in North Carolina we're very fortunate to have some of the best continuing care retirement communities of any state. We have some that we ought to really be proud of, but I think what you're doing and what the Department of Insurance is doing is thinking forward, because these are tough business models and the finances sometimes can get very tricky. And so I think this is a very forward-thinking bill to make sure we don't find ourselves in a position like some states where they then have to come in and, I call it, bail out a community because they would not manage well. So I actually commend you for this bill.
I will say, there's a website dedicated to, especially for these types of communities on the DOI website. And I browse it, and I encourage you to do the same. I think they're CCRCs in about 22 counties in North Carolina, I believe. I may be wrong, but anyway, I found that interesting.
Representative Setzer?
Thank you, Madam Chair. I move for a favorable report to the PCA for House Bill 357 as amended, unfavorable to the original bill, enrolled into a new committee substitute, and re-refer to the Committee on Finance.
The motion before us to, it's all good.
For favorable report.
For the favorable report with all that mouthful. Those in favor say aye. Those opposed, Motion carries. I'm turning it back over to Representative Humphrey.
Thank you, Madam Chair. All right. Representative Setzer is recognized for comment.
Thank you, Mr. Chair. I don't want to belabor the moment, but I would like to thank a person at this table, Ms. Kristen Harris, who has endured us for the last 10 years and is retiring from the General Assembly to go back into private practice. She has been kind, faithful, diligent, and helpful. And we're not always the easiest group of people to deal with, but we do our best. But you have been very much appreciated, and I wanted to thank you for your kindness.
And I echo those remarks. She has been very helpful and very smart young lady. So we wish her the best in her next endeavor. All right, this meeting is adjourned.
And you're
Thank you.
welcome back anytime.